Did you know there's a hidden link between ADHD and why some people turn to substance use? But wait, isn't ADHD just about being easily distracted or overly active? Not quite. It's a surprising truth that so many miss, including healthcare professionals. Today, we're going to be uncovering this mystery. For anyone touched by these challenges, understanding this could be life-changing. It's not just about awareness, it's about finding real solutions. We'll dive deep into how undiagnosed ADHD can lead individuals down a path they never intended to take. And we'll explore why recognizing this link is crucial for both healthcare professionals and those seeking help. Your time spent with me today isn't just about watching a video, it's about empowering yourself with knowledge that's rarely talked about, but immensely impactful. And not to be dramatic, but with record-setting drug overdose deaths every year, this information could save a life. And who am I to talk about this? My name is Dr. Salman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And for so many of my patients with substance use issues, making this missing link has been the key to successful treatment. ADHD, or attention deficit hyperactivity disorder, is often pictured as just a childhood issue, full of hyperactivity and classroom disruptions. But what if I told you that's only a tiny piece of a much larger puzzle? In reality, ADHD is a complex neurological condition that persists in adulthood for many, and it doesn't always look the way you think. It's not just about being unable to sit still or pay attention in class. Instead, it's about a unique wiring of the brain that impacts everything from concentration to impulse control, and yes, even susceptibility to substance misuse. ADHD is characterized by a range of symptoms: inattention, hyperactivity, and impulsivity. But it's the subtleties that often go unnoticed. The inattention isn't just about losing focus, it's about struggling to regulate attention, often hyperfocusing on one thing to the detriment of others. The impulsivity? It's not just about being rash, it's about difficulty in delaying gratification, which can lead to risky behaviors, including substance misuse. Now, let's bust some myths. You might think that ADHD is just an excuse for bad behavior or poor discipline. But is that really the case? ADHD is not about a lack of willpower or discipline. It's a medical condition with well-documented brain differences. Those with ADHD aren't just being lazy or seeking attention. They're dealing with a brain that processes information and stimuli differently, making everyday tasks more challenging. The reality is ADHD affects every aspect of life, from work performance to personal relationships. It's not just a matter of trying harder, it's about managing a brain that operates on a different wavelength. And when left undiagnosed or misunderstood, it can lead people down paths they never intended to take, like substance misuse. So, how does this misunderstood condition lead some to substance misuse, and why is it crucial for us to understand this link? Imagine this: a person struggling with focus, restlessness, and impulsivity, traits typical of ADHD. But instead of a diagnosis and treatment, they find a different kind of relief in substances. This isn't just a hypothetical scenario. It's the reality for many undiagnosed ADHD individuals. They often turn to substances, not for recreation, but as a form of self-medication. But why? Because these substances can temporarily alleviate the symptoms of ADHD, providing a sense of calm or focus that they desperately seek. But here's the twist. While these substances might provide short-term relief, they can lead to long-term problems, including dependency and worsening of ADHD symptoms. It's a dangerous cycle where the very thing they use to cope can end up exacerbating their struggles. Studies show this and back this up. Research shows a significant correlation between ADHD and higher rates of substance misuse. For instance, one study found that adults with ADHD are 3 times more likely to develop substance use disorders. Looking at nicotine use specifically, people with ADHD not only have a higher prevalence of smokers as compared to people without ADHD, but they also start smoking earlier and have lower rates of being able to quit. So, despite us having all this research and data to prove this link, why is this connection so often missed? And what can be done to address it? Diagnosing conditions like ADHD in those with substance use concerns is a tightrope walk. But why? Because the symptoms can overlap and the waters get murky. ADHD is often masked by substance misuse, leading many professionals to overlook it. The treatment focus tends to be on the substance itself, while the underlying ADHD, a key piece of the puzzle that often drives the substance use, remains hidden. It's written into every disorder in the DSM, the quote-unquote Bible of psychiatry, that this disorder cannot be better explained by the effects of a substance or medical condition. This oversight isn't just a minor miss, it's a critical error that can derail recovery. When ADHD is missed in addiction treatment, individuals are less likely to find long-term success. They might overcome substance misuse temporarily, such as completing a 28-day rehab stay, but without addressing the ADHD, they're at significantly higher risk of relapse. It's like fixing a leak in a boat, but ignoring the hole in the hull. In the realm of treating ADHD, especially in those with a history of substance misuse, there lies a significant controversy amongst many people who treat substance use disorders: the use of stimulant medication. Many healthcare professionals hesitate to prescribe stimulants to individuals with a history of substance misuse. They're concerned that these medications might lead to a new or worsening substance misuse. While this is a concern with a long history of stigma towards adults with ADHD, it's still a delicate balance between potential risks and the necessity of treatment. However, the story doesn't end there. While the risks are real, the benefits of effectively treating ADHD cannot be ignored. Research and clinical experience show that when used appropriately and under medical supervision, stimulant medications are not only safe, but highly effective on multiple levels. Oftentimes, effective treatment of ADHD can lead to significant reductions in substance misuse, with stimulant medications working for about 90% of people with ADHD. Ultimately, the most effective treatment for ADHD, particularly in the context of substance misuse, requires a balanced approach. It's not just about taking a pill, stimulant or non-stimulant medication. It's about integrating behavioral therapy, lifestyle changes, and support system. This holistic approach ensures that treatment addresses all facets of the individual's life, leading to better outcomes. As we navigate these controversies, it's clear that understanding and flexibility are key in treating ADHD, especially when intertwined with substance misuse. But what does this mean for healthcare providers and patients alike? Understanding the intricate relationship between ADHD and substance misuse isn't just about awareness. It's about unlocking doors to better health and a more fulfilling life. The good news is, with proper care and an integrated approach to treatment, individuals struggling with ADHD and substance misuse can not only manage their conditions, but also thrive. The potential for a transformed, healthier, and more balanced life is real and achievable. To my fellow healthcare professionals, I urge you to consider the full picture when treating patients with substance misuse. Look beyond the surface, consider ADHD as a potential underlying factor, and approach treatment holistically. Our role is not just to treat symptoms while the patient is in front of us, but to change lives beyond the clinic or hospital or rehab walls. And to those of you who may be facing these challenges personally or within your family, know that you're not alone. Seek out professionals who understand the complexity of your situation. Advocate for comprehensive care that addresses both the ADHD and the substance misuse. Remember, your journey to wellness is a path always worth taking. Thank you for joining me today. If you found this information helpful, please consider subscribing and following for more insights into mental health and well-being, as well as going through these controversies that make other people a bit squirmy. Drop a like and let me know if you struggle with substance misuse and ADHD in the comments below. Together, we can break the stigma and spread knowledge that can truly make a difference. Take care and see you next time.